Thank you for joining the first in VITL series of webinars about the VITLaccess Provider Portal. We appreciate your interest and encourage you to participate in the two following webinars during January and February 2017. The schedule and sign-up links are listed on the second to last slide in this presentation. Before we get started, I'd like to introduce the presenters today. Joanna Cummings, who is currently speaking, and Andrea De La Bruere, who will introduce VITLaccess and the concept of patient consent. The video recording of this presentation will be posted on the VITL website at vitl.net/access. For providers who are unfamiliar with VITL, we will review the concept of Health Information Exchange, HIE, which is at the heart of the work VITL does to connect healthcare and exchange information that improves patient care. So what is Health Information Exchange and why is it important? Health Information Exchange is the secure and efficient transfer of patient health information, and it allows providers to share a patient's vital health information electronically. Vermont is among the states that received federal funding to develop an HIE that builds connections to provider electronic health record systems, lab systems, registries, and other networks in order to share patient information with patient consent. VITL is a nonprofit organization that was incorporated in 2005 as Vermont's exclusive health information exchange. We manage a secure statewide network which gives Vermont healthcare providers, again with patient consent, the ability to electronically exchange and access patient information. Our role in healthcare reform is threefold. We develop and maintain the VHI, also known as the Vermont Health Information Exchange, deliver services and solutions to providers, and we assist our state's providers with the adoption of health information technology. VITL's operations and services includes an operations team that builds interface connections from healthcare organizations to the VHI. Our technology team manages VITL's IT infrastructure and future analytical services. Our client services team assists healthcare organizations with the adoption and use of VITL products and services, including VITLaccess, and provides consulting services. The graphic represents contributing, receiving, and querying processes that take place within the VHI. Healthcare organizations, represented on the left, may contribute to and receive patient information from the VHI. Patient information in the VHI also flows into VITL's health data management infrastructure and is then sent to accountable care organizations such as OneCare Vermont, the Vermont Department of Health Immunization Registry, the Vermont Blueprint for Health Registry, and the Patient Paying Event Notification Service. The VITLaccess Provider Portal at the bottom of the graphic functions as a query and retrieve system to view patient information, and we are proud to announce that very soon providers will be able to query the National Veterans Affairs Health Information Database as well. So now I would like to turn this over to Andrea.
Thank you, Joanna. So what is VITLaccess? VITLaccess is a secure web-based portal that gives providers access to real-time, statewide clinical data available in the Vermont Health Information Exchange for a more complete view of a patient's medical history. VITLaccess is already being used in a number of care settings, such as hospitals, primary care physician offices, federally qualified health centers, and a number of others. You will be able to view important information about your patients, such as medication history, admissions and discharges, demographics, clinical summaries, laboratory results, radiology reports, and transcribed reports. Why should you use VITLaccess? For new patients, VITLaccess may be helpful to search and retrieve records of previous care at other healthcare organizations. For existing patients, you may find information that you may not have known about. To be able to review information when you need it, VITLaccess is web-based, and it offers 24/7 secure and immediate access to patient records. You will be able to track patient care and build a more complete patient history and avoid duplicate and unnecessary procedures, tests, and costs. A few VITLaccess user statistics for you. There are currently 143 healthcare locations using VITLAccess across many healthcare segments. There are currently 2,430 authorized users of VITLAccess. When patients are asked to provide their consent for providers to access their information available through the VHI, 96.4% of them say yes. 3.6% of those patients decline. We wanted to give you an idea what it looks like when after you log into VITLAccess and search for a patient that has already provided consent. Mr. Hart is one of our test patients. This information is fictitious and is used for demonstration only. We are viewing the patient's summary screen, a cropped version of it. You can see the black box to the left, patient summary, and underneath that, encounters, results, medications, and documents. This allows you to navigate around VITLAccess to see what information Mr. Hart may have available. The banner at the top, you can see his gender, his age, his date of birth, as well as the most recent facility he visited. You can also see that on 8/6, Mr. Hart presented with tooth pain, fatigue, headache, and anxiety disorder, and then a few days later on the 10th, he had some lab work done. Many patients visit a number of different healthcare providers to meet their needs. In this example, Mrs. Alexander goes to Northwestern Medical Center, and her providers may not have access to all of her medical information. The pie chart on the right shows a breakdown of all of the patient data in the VHI for patients who have received treatment at Northwestern Medical Center since early 2015. When looking at the graph, we see that only 25% of the patient information originated at the local hospital. A full 75% originated at UVM Medical Center, as well as other community providers. This means that VITLAccess is the single source for a very broad view of statewide patient information from many data contributors. We wanted to share a few provider testimonials with you. I think it saves money. You're able to see clients in a much more efficient manner, said Mimi Bernier at Lamoille County Mental Health Services. VITLAccess has streamlined our office activities, and it's definitely improved the care of our patients, said Dr. Lockridge from Northeast Kingdom Hematology Oncology. And with VITLAccess, we are better able to understand the person as a whole, said Paula Ducharme at Derby Green. Full videos of these testimonials are available on our website in the Multimedia Library section. We wanted to give you a brief overview of the Vermont Patient Consent Policy. We will go into greater detail during the next webinar, but Vermont consent is called a global consent. This means that once consent is given by a patient, any current or future treating provider is allowed access to all data in the VHI for that patient. A patient must give written consent to allow a treating provider's access to their health information in the VHI. It's important to note that a patient does have the right to change their mind at any time. Patients cannot choose which treating provider may or may not access their information after they consent to share it. Each healthcare organization must verify that a patient has provided consent or receive a patient's written consent before viewing the patient's statewide health information. You can find more information available on the VITL website about asking patients for consent. Looking ahead at the next two webinars, January 10th is the next one, New User Support. We will touch on the topics of patient consent in more detail, basic administrative and clinical support, patient search, and care setting specific use cases. And on February 21st, the VITLAccess Advanced Training and Live Demonstration will include topics such as workflow, advanced training on medication queries, CCD content, care setting specific use cases with demonstration patients, and transitions of care. If you have more questions about VITLaccess or want to enroll now, please contact us at clientservices@vital.net or by phone 802-861-1800 or email Judith Franz, our Vice President of Client Services, at jfranz@vital.net. We appreciate your time and attention. Thank you for joining us. We hope we'll see you at the next one.